So the fifth intra-oral finding was binding down of a tongue. In the patients of OSF, you will find it more often that the patients cannot protrude their tongues to the maximum level because of the involvement of lateral posterior tongue, and they cannot protrude the tongues to the maximum level. In this clinical picture, I have asked the patient to protrude his tongue, and this is his maximum level of protrusion to the level of lower lip, which is very less than the normal. Now, the areas that were involved were buccal mucosa, as you have seen in the clinical picture, buccal vestibule, you will see in the next slides as well, labial mucosa, labial vestibule, hard and soft palates were blanched, palatal fosses, retromolar pad, and lateral and posterior tongue, due to which patient cannot protrude their tongues to the maximum level, and it will result in the binding down of a tongue. Now, the risk of malignancy. Basically, oral submucous fibrosis is the precancerous and pre-malignant condition. There are two more conditions that can occur with it, that are number 1 leukoplakia and number 2 erythroplakia, due to which it undergoes malignant transformation in 4 to 8% of cases, and it significantly contributes in the high incidence of oral cancer in Indian subcontinent as well as in Asian origin because of the consumption of betel nut, areca nut, and betel quid. Now, the investigations that we advised were CBC, serum ferritin, and periapical radiograph of the affected tooth, that was the tooth number 42. CBC was advised to check his hemoglobin and hematocrit level. One thing you'll find, and one thing which is very much suspected in oral submucous fibrosis patients, is that there will always be suspected iron deficiency, because patients are so addicted to the habit of consumption of areca nut, betel nut, that they will not consume the healthy normal foods. So they will not consume the enough iron, and it will not metabolize to the normal levels, and there will always be the suspected iron deficiency. Serum ferritin was advised to check his iron levels, same for the iron deficiency, suspected iron deficiency, and serum ferritin is the gold standard test to check iron deficiency, to confirm iron deficiency anemia as well. And the periapical radiograph was advised to check any underlying pathology, any underlying infection or condition that can lead to localized gingival hyperplasia. Now, this is the CBC report. In normal adult, it ranges from 13.7 to 16.3 gram per deciliter, but in this patient it was found to be 12.1 gram per deciliter. That is very much less, and that is 1.6 gram per deciliter less than the normal average value. Other than that, his hematocrit levels were significantly reduced, and it was found to be almost 35%, but in adult patient, in adult male, it is normally ranges from 40 to 54%. Moving on to the serum ferritin report, in adult male it is found to be 28 to 365 365 nanogram per milliliter. These are its normal ranges, but it was found to be 16.63 nanogram per milliliter in this patient, which is very much less than the normal average value. So these two reports of CBC and serum ferritin confirmed the iron deficiency anemia in this patient. Now, the radiographic findings, we found the bone loss and pocketing around the affected tooth, as you can see in this radiograph. This is the tooth number 42, that is lower lateral right, that is lower right lateral incisor. This is the bone level, and this is the bone loss. These are the markings of pocketing. If I combine the extraoral and intraoral